Thanks everybody for your patience. We're going to go ahead and get started. We're having a little bit of extra effort to get the phone line hooked up, and we'll be doing that. Should be coming on here pretty soon. So I'll go ahead and get things started. Welcome everybody. My name is Mark Romick. I'm the Deputy Director of Alaska Housing Finance Corporation, and I'll be sitting in for Brian Butcher, our CEO today. Brian extends his apologies for not being here. He had a last-minute family emergency that he needed to be in Anchorage for. So I will endeavor to do as succinct and efficient job as Brian always does. With that, I'd like to welcome everybody here today to the meeting of the Governor's Council, Alaska Council on the Homeless. Also take a moment to thank the Alaska Housing staff that are here and helping with the event. I would like to acknowledge that we have a number of people on the phone who I'm not sure that they're available to chime in right now, but we have several members of the council: Diane Casto, representing the Department of Public Safety; Betty Svensson, representing the municipal government seat, will be on the phone momentarily. With that, I'd like to ask my colleagues at the table here to introduce themselves, starting at my far right with Mr. Dave Kuiper.
Hi everybody, my name is Dave Kuiper. I'm from Anchorage.
Hi everyone, I'm Dean Williams. I'm the Commissioner for the Department of Corrections.
Hello, my name is Randall Burns. I'm the Director of the Division of Behavioral Health. I'm representing Commissioner Davidson on the council.
I'm Owen Harris with North Pacific Rim Housing Authority, and I'm representing the Association of Alaska Housing Authorities.
Good afternoon. I'm Sanna Eford. I'm Deputy Commissioner for the Department of Education, representing Commissioner Michael Johnson.
Steve Williams, the Acting Chief Executive Officer for the Alaska Mental Health Trust.
Do we have to turn it on? Susie Pearson from Awake, and I'm a public member from Anchorage.
Carrie Collins with Alaska Housing Finance Corporation, providing staffing support to the council.
Thanks, Carrie. The next item on our agenda is public comments, and I would just like to remind people to keep your comments to be between 3 to 5 minutes if you can. And Carrie, would you mind calling the first person?
So, Evelyn with First City Homeless Services. Can you please come up to the mic up here? Thank you.
Hi, I'm Evelyn Early from First City Homeless Services in Ketchikan. And for those of you who don't know where Ketchikan is, it's the first city coming up the coast from the lower 48, which means we see an influx of individuals who otherwise want to go on a Alaska excursion or move to Alaska to work in some field someplace, to realize that they end up on an island in the Pacific Ocean and have no money to go someplace else. So one of the impacting factors of homelessness in Ketchikan is we're an island in the Pacific Ocean that receives 12 feet of rain a year. We don't have a lot of space for housing. Many reasons lead into that. However, what you want to know is that we are receiving from the lower 48 an influx of individuals who otherwise would very shortly time not be employable someplace else. They'll come to work having received employment from online for the cannery, or for the cruise agencies, or for the tourism industry. They'll arrive in Ketchikan with all of their mental, physical, emotional, and addictive baggage, receive unemployment within the first week or two, and then they stay in Ketchikan. We want you to be aware of the fact that the largest influx of homelessness, influx to Ketchikan, not locals, but influx, are the young men and women who are addicted to opiates. They are unpredictable, uncontrollable, and unpleasant people. First City Homeless Services is a wet shelter. We opened a day shelter in the Social Hall of the United Methodist Church in 2009, and they have made that social hall home. We are open 7 days a week. We serve breakfast 7 days a week. To date, we have received 270 individuals 6,500 times. And that's at the day shelter. Last year, we started an overnight warming center in conjunction with the Salvation Army. It was a pilot program because the police and the emergency services were asking us, can you relieve us? Somehow you need to help us. So we opened up a warming center this year at the same site as the day shelter in the Social Hall of the United Methodist Church. We opened October 1. We will close on March 31. And to date, we have seen 35 individuals at the overnight warming center over 100 times. So these are 35 people who have come back and forth. The reason it's an overnight warming center is because there is no facility in town with a sprinkler system that we could even fathom to rent. The First United Methodist Church is giving us their place for 18 hours a day for less than market value. They are making no money on renting us their facility. It's part of their outreach and ministry into the community. But there's no sprinkler system. So we who have ethics and morals and want to keep people alive and treat them better than your dog sleeping on a carpet can't offer more than that. The fire code says if you don't have a sprinkler system, you cannot accommodate the sleep of anyone. You can't offer them a pillow, a blanket, or even a cardboard to lay on. So what we have during the day shelter, which is wet, and the night shelter, which is wet, any time of the day you come in, there'll be men and women sleeping on the floor all around the perimeter of this social hall because we can't offer them accommodations to sleep. We hope that there's some place in Ketchikan that eventually we would be able to house people in a humane fashion. We are a minimalist emergency shelter that says anyone who does not want to die on the street, anyone who does not want to live on the street is welcome at this shelter. One of the things that we've done is we've coordinated to give evidence of who comes to the night shelter and the day shelter. We coordinated color-coded. If the police brings you, you get daily intake a blue, or the emergency red, or the emergency room yellow, so that at the end of the season we're able to go before the borough and we're able to go before the city and say, this is the amount of money we've saved you. The police have brought this many people. The emergency services have brought this many people. So we expect that we will see well over 100 people at the overnight warming center in our 6 month of being open. And we will see them close to 1,000 times. So we want you to know that there are some issues based on location in this great state. We are convenient from the lower 48, and as you know, they fly people up and put people on the ferry with a one-way ticket. That the largest influx of non-resident homeless people coming are the young opiate addicted. We have no facilities to cope in Ketchikan with the mental health needs or the physical needs or the addictive needs of this population of people. We have our local community of addicted, born and raised, of chronic inebriates, born and raised. That is the purpose of our shelter, is to keep those who are born and raised and call Ketchikan home safe and alive. But we're being overwhelmed, and we would like you to hear from us loud and clear that we are pedaling as fast as we can to keep people alive. In the winter of 2015, 4 of our local chronic inebriates fell into the ocean. It's not freezing like Nome or Fairbanks or Anchorage, but they fall into the ocean and they die just as fast as they would if they froze to death. So we are trying to address homelessness in Ketchikan, but we are only able at this point in time to do that on an emergency basis. We can talk later about permanent housing. Do you have any questions? Is this the time I ask for money? After the meeting? Please remember, First City Homeless Services, Ketchikan, Alaska, 99901. Bye.
Thank you. Carrie?
Thanks. The phone line's working now, so can we take a brief interjection for me to call out?
Yes.
Thanks.
Taking a moment pause to hook the phone up. Hello, this is Mark Romick with Alaska Housing calling for hook up the Alaska Council on the Homeless. Who do we have on the line, please?
Hi, Mark. This is Stacy Schubert.
Hi, Stacy.
Hi, Mark. This is Diane Casto from CDVSA.
Thank you, Diane.
Hi, Mark. This is Elaine Phillips with Habitat for Humanity.
Great. Is Betty Svensson on? Okay, perhaps she'll join us in a few minutes. Carrie, you want to continue with the public comment?
Yes. Let's hear from Agnes Moran with Wish.
I'm Agnes Moran with Women in Safe Homes in Ketchikan. I guess you guys get the Ketchikan contingency today. I'm also on the board of directors for City Homeless Services. Because one of the things I've noticed in my years of working with homelessness is there's definitely a tie-in between women who are caught up in a sexual assault, or individuals caught up in sexual assault, domestic violence relationships, and homelessness. I run a 32-bed shelter. We're supposed to be an emergency shelter. We're supposed to be 30 days. When I left on Friday, I was at 30, 16 of those were children. And I'm sure if I called in today, I'd be at 32 or higher of capacity. I'm only supposed to hold these women for 30 days. When an average rent in Ketchikan for a one-bedroom apartment is almost $1,200 a month, there's not a lot of options for these women once they leave the shelter. We have no transitional housing. We have no women's shelter in town. So inevitably, when they leave us, my advocates do a great job of helping these women put their lives back together. But the next step is not there for them currently. I have 2 Alaska Housing Finance Corporation vouchers. They roll over every 2 years. So inevitably, these women leave, and their only option, a lot of times, is to go back. And then they'll be back with me again, 3 months, 6 months, but they'll be back. And so when you're looking at long-term solutions for homelessness, we have to consider transitional housing, reentry housing, the whole panoply. I know Housing First is out there too, but even to get folks back out and functioning, we need to have that interim step for them, because many of these women can be successful. I had the ability to put 4 women and 6 children into transitional housing with a one-time grant. Every one of those women and kids are still out there, and they're working today. So if we can put the supports in place for them to get them over the hump, we can have them be successful. But we need the capacity, and we don't have it. So questions? Yeah. Thank you.
Thank you very much. Carrie?
Rhonda Snyder with Nome Community Center.
I represent an agency that's an umbrella organization for 6 different human service programs: the Children's Home, the Senior Center, the Food Bank, Family Support Services, and Boys and Girls Club. We're supported primarily with state grants and a few private foundations and 5 different meal reimbursement programs, most of them USDA programs. The lack of housing, poor housing, and overcrowded housing affects all 6 of our programs. in a really significant way. I just want to give you two examples of two of our programs and what the effect they have. Our Boys and Girls Club, for a small community of 3,500 people, takes care of about 40 kids after school every day. We're open for 6 hours. Our kiddos get on the bus in their homes in the morning. They go to school, spend the whole day at school, get off the bus at our Boys and Girls Club, and stay there till 8 o'clock at night because they're not really welcome home because their homes are overcrowded or noisy. They can't get homework done. And we know that the amount of sleep a child has, the amount of nutrition, the proper nutrition definitely affects their ability to be successful in school. Another thing that we see is in our family support program, we're funded by 3 OCS grants. 50% of our families that we support have children living in Nome that have been removed from their village homes by OCS. And the communications between those families in the villages, the amount of time they spend on visitations and reunification is very much affected by their ability to provide safe housing for their kiddos. Data shows that we're spending money on the symptoms of these negative effects from poor housing and overcrowded housing, and I think we need to consider spending our money differently, spending it on prevention and providing housing up front so that we can eliminate some of these things and spend our money on preventing it instead of causing trauma to children and their families, and then trying to spend our money on fixing those problems. Thank you.
Thank you.
Thank you. Eva Malvich with Bethel Winter House.
Good afternoon. Guyana, thank you for allowing me to speak before you. My name is Eva Malvich. I'm a resident of Bethel, Alaska. I'm a tribal member of the native village of Mikoryk. I've been in the YK Delta since I've been born there. I'm a founding member of the Bethel Winter House Lions Club. We're a nonprofit 501c3. We're a volunteer board of 4 people. We started the shelter operations in 2013 when 11 of us decided to get together and do something. We were all pretty darn frustrated with the fact that nobody's doing a darn thing about people dying on the streets and in cold homes, including my family members. Last year we served over 1,600 people. We served 1,688 people. I know that because I do the point-in-time homeless survey with everybody that walks into the shelter. I have an office in my bedroom where I do my paperwork because none of us are part of social services. Our chair is he runs the bank, local bank. His wife, she's a board member. She's a stay-at-home wife. Our third person is an artist. Myself, I did this because too many of our people are dying. The people that we serve are between 18 and over 70. Some are stuck there because they get to Bethel for medical and don't take that next plane home on Medicaid and get stuck there. Some are banned from their villages, and that's a big problem. If they ban a person from their community, they're sending them to us. They're primarily Alaska Native males. And our census for last year was we had a minimum of 4 people one night and a maximum of 27. Our challenge is securing a location. Organizations and businesses are afraid of personal liability. We've been told over and over again by nonprofits, the social service and the healthcare organization, they do not have any money, and no, they can't help us. Organizations are hesitant to partner with us. And unfortunately, our grant is dependent on us securing a location, or we will lose funding. I had to write a special condition report to the state. We have a grant through the Community Initiative Matching Grant Program that if we don't have a location, secured by October 30, according to my promise to them, that we probably won't open on December 1. I found a place where we can purchase liability insurance for $5,000. That's a lot of money for our shelter operations. Our bank account is at $45,000. $29,000 of it is for the 2 people that we pay. We need to facilitate partnership with other entities, but unless they have something to receive in terms of maybe a tax break or incentive through money, nobody wants to help us out, it appears. My motto is everybody loves us, but nobody wants to get near us. It's very hard, it's very frustrating, but I'm very thankful I'm here. When I sat down in the beginning of the convention, I was somewhat relieved to find out I'm not in this boat by myself. Other communities are going through the same challenges. We don't have the infrastructure that bigger communities do, and that's a problem. I'm hoping in 20 years, by the time I retire, I don't do this after work, because I spent 4 months out of the year dedicated to the shelter operations from December 1 to March 31st when we stay open. I'm on call for anything that could happen, and that's very stressful. So again, we have a challenge with liability insurance for 501c3 volunteer shelters that need a place to stay. We can't afford purchasing liability insurance all the time, but if that's what it takes, we might have to do that. And our only goal is to prevent death by exposure for the people in our region. That's it. It's very simple, and it works. Guyana.
Hold on one second, Eva. Any questions?
Eva, thank you. May I clarify the number that you stated? You said 1,688 people. Are those unique individuals, or is that the?
Yes, that's everybody. Everybody has to fill out an application. I counted that list 3 times.
Okay, thank you very much.
If you don't have a location, how are you doing it right now in terms of putting these people up at night?
We don't open until December 1. For 2 years, we had the Salvation Army at Bethel, but they closed down their facility when they said Bethel was too expensive for them, and they completely pulled out. They're selling their building for $500,000. And they're also looking for somebody to take over their food bank program, which we can't do. We're too busy right now.
Thank you.
I had a question.
Susie?
When you're talking about the partners in the community that aren't willing to work with you, who are those partners, and how can others assist in building those relationships?
Okay, so I'm on personal time off. I came here on my own time. I work for YKHC, that's the healthcare organization. We asked them, they said there's no money. ABCP Incorporated, the social services organization for the tribes, said they have no money and they can't help us. We approached the mayor, I did 2 weeks ago, and he said, according to their administration, they're hesitant because 1, they're afraid of liability, and 2, we don't have much money, so we're not a great incentive program for them.
What other shelters do you have in your community?
There is a women's shelter for individuals that are experiencing trauma, but other than that, I think we're the only show in the region, really. There is nothing else.
And when you were talking about the banishment issue and people being banned from their villages, that's a very difficult and complicated issue right now, and as a discussion for our communities. How do you see, how can you resolve that, or do you have any suggestions about addressing that?
What I say is, because myself, I'm a tribal member of the native village of Mikoryik. Bureau of Indian Affairs provides money for the tribal member of that community. I chose to move to Bethel to work. But if an individual from a certain tribe of a certain village has nowhere else to go, and their immediate family is there, If you ban that person, you're really cutting them off from everything, their family, their subsistence fishing and hunting grounds, and really tribal funds for that particular person's health and social welfare. They're stuck.
Thank you so much.
Any other questions? Thank you, Eva.
Next is Nancy Burke with the Municipality of Anchorage.
Good afternoon. I'm Nancy Burke from Mayor Berkowitz's office. I'm the Housing and Homeless Services Coordinator for Anchorage. I partner very closely with Christy Duff, who will be providing an update on the Anchorage Coalition to End Homelessness. And there's a third partner in our group that we call a backbone that's working on our community plans, and that's United Way. And the goals for our community plan include arranging programs and services so that we can most easily find people who need assistance getting to safety and housing. We can identify housing units for those individuals and then make the money work so that we can do all three things at once. Have finances that sustain people in housing, enough available units for persons in our community, and services that find the person where they are, meet their needs in the right level, and help sustain them in housing. While that's a simple formula, it's a really complex thing to try to do for a larger community. And the way that I think about it is the work that the mayor's office is doing is really providing some resources around our COC. Our COC operates the safety net. They are HUD grantees and perform the core functions of a homeless service safety continuum in the community. However, the continuum is not as broad or as deep as we need, and when we're not able to meet people's needs in a safety net, we find them falling into broader community systems, such as the police department, the fire department, our hospitals, and to some extent our schools. And so the work that the mayor's office is doing is helping to convene those municipal entities that can help shore up the safety net and provide extra political resource and help to our community grantees, to our COC. To do so, it involves my work of coordinating those municipal entities. The police department has been engaged and excited about this work because for a long time they've seen the outcomes, some of which were mentioned in the meeting this morning around people who are intoxicated and who may become violent and sleep off, or those who are found out in the community and are unable to care for themselves in that moment. The police are really part of the front line, along with the fire department, in making those determinations about how best to serve this person in the right program in the community. So we've located a social service coordinator position within the Community Action Police team at the police department. And this is a person who is a resource to the police so that they can best know where to refer a person, how to connect them to the right services. I think my first day on the job, I had 3 different patrol officers calling and saying, I came across a homeless person, how do I get them to the right place? And that kind of interaction, the police continually trying to find the right place for people, helped us move forward in doing the social service coordination position. The police are interested in expanding that work into mental health, more mental health technical assistance in the field, and in our community we've had some changes in how funding comes through. So we're talking with the police department and some of our providers around expanding that resource, which primarily, I think if you ask the police and the fire department, the individuals who we find most in contact with them are individuals with a mental health issue, individuals with longstanding addictions, and individuals who have a history of traumatic brain injury. Those are the folks that are not easily making it into our safety net or staying in housing in the community, and those will continue to be the focus of the mayor's office and our backbone partners in the community. The challenges that we have in doing that is that lots of the money doesn't line up in the right way to help us coordinate these resources and to move people in a timely way from where we've encountered them in a camp into permanent housing. In fact, one of our major programs was reporting more than 200 days from the time that they engage someone to the time that they're able to get housing. That's not uncommon for some of the programs that we're working with. We'd like to see that number down to 3 days. So we have some work to do in Anchorage. So if any of you in the audience felt like you were, you weren't making enough progress or where others are, feel comforted that Anchorage has a lot to do also. The challenges remain around the resources for housing. Anchorage is behind in affordable housing production generally, and Anchorage has very little access to capital resources and operational resources for permanent supported housing. I have 100 units of housing sitting ready to go in Anchorage, but for the ability to operate them with resources. Access to rental vouchers with case management remains the challenge for project in our community and communities across the state. We simply need more resources. Now that we've organized and now that HUD is asking communities to organize coordinated entry and the resources, we now will all see the same bottleneck that Anchorage has. Our bottleneck happens at our shelter, where our shelter has about 2 times the number of people that we can accommodate in shelter right now waiting for some assistance. So access to vouchers, access to case management to go along with that, and in some measure, you still have to do projects that are single site projects, like the very successful project that just came online in Juneau, and the 3 projects that we have in Anchorage and Fairbanks, South Cushman Housing First program. So if we have an ask for the council, it's that you continue to consider that. I know that the council will likely say this is probably not the year to add money to the budget, and this is probably not the year for it. But this will be my 13th year of us saying this is probably not the year. So I think if the state's putting themselves back on track, if we're going to have some way to sustain ourselves as a state, we should ask to be in the formula. We should ask for a formula for every community as we develop housing, period, that there should be a set aside for permanent supported housing to help solve our homeless crisis. It can be a percentage that we pick. We can ask local communities to provide match to that. I know Anchorage has some allocations of the federal resources, and the mayor has asked me to commit all of our federal resources to housing for people if we can get the money to flow in the right ways. And so
Nancy, excuse
that's
me.
my ask.
Could you wrap up? We've got a couple of other people, and there's some people that have to be at a workshop at 2:30, so you could.
Absolutely.
Thanks.
There you have it.
Okay.
That's my
Thanks.
ask.
All right, thank
so
you.
fix that and we'll be good.
Okay. Questions?
I have a quick question. When you're asking for the state to add more money to the budget, you've got specific state departments here. What kind of requests have been made to those departments? Because truly the council doesn't funnel or determine money. The departments do. So which ones are the most effective in helping or have been able to partner with you?
Well, I'd like to call your attention back to a time when the council did do that. And in 2008 and 9, we ran an advocacy campaign. The Mental Health Trust Authority, where I was previously, worked with the council to advocate for a housing trust program. And that's when the Special Needs Housing Grant Program was added, because each community needs a specific mix of resources. And what we really need is an independent body to help us do underwriting for projects so that we can access each community's resources. It's different in every community. And I would say that all the departments are interested in helping and doing really key pieces in each of their areas, but there's no one sitting in the middle of it saying, let's make this work at the local level. I just heard that Nome's going to do a tax credit project, and that caused me to think about who's going to help them do that. You know, you need an entity to sit in the middle to help coordinate and do that.
Thank you. Any other questions? Carrie? Thanks, Nancy.
Great. Next we have Delbert representing Savunga.
Yes, my name is Delbert Pangari, president for the Native Village of Savunga. First of all, I'd like to thank our Creator for this opportunity, as I was taught by my grandparents. And I'd like to thank Sue Stanacker for inviting me to come here to sit on a panel. Quickly, I highlighted what I wanted to comment on. The high cost of living in our communities. In Savoonga alone, we have 75 families within families. We've had housing crisis for many years, 2 to 3 families living within 1 3-bedroom, 21 people living in a 3-bedroom. I will like to speak about my aunt. A few years back, she got a housing from BIA Housing. Poor design, not enough air vents. We've gotten black mold, health issues. If health official would look at some of these homes, would be unfit for living. And their 6-year-old child was medevac to Anchorage for respiratory problems, and many of those families with black mold problems, and they're constantly going to the health aides and being sent to Nome. The children, the elderly people with respiratory problems, the highest risk ones that we have concern for. Many of our people have totally given up applying for housing because the few houses that we get are going to the most desperate, and some have built with their own few dollars. They get material that they gather, turn their garages, their parents' garages, into homes, and still they have families within families. The last time Bering Straits Housing Authority built houses in Savoonga was 10 years ago, and we're thankful this summer that they are building almost completed 2 2-bedrooms, 2 4-bedrooms, one duplex. Our biggest, and that 75 families within families is still growing. Where population is under 1,000, last census was a little over 800. So I've seen some of those homes. Some of them date back to the 40s. They have no choice but to live in them. Those old, very old houses, they put blankets and make small area to be heated to live in there. One of the biggest problems that we have concern for is the health issues that are elderly, who's more susceptible, the children. That's my comment for you today. Thank you very much, and God bless to all.
Thank you. Any questions from the council for Delbert? Thank you.
Thank you.
Great. Next is Sue Steinacker.
Yeah. Is she the, is that the last public comment?
There's one more, but she's under the
Sue, why don't you come
time
forward? I know that you have a time commitment here in a few minutes, so why don't you take care of both of yours at the same time? How's that?
Okay. And yeah, to those who are planning to attend the rural session that starts at 2:30, I guess I'll be over there after all, but it might be a little bit slow waiting for others to finish up, and we'll wait for you. Okay, my name's Sue Steinacker with the Nome Emergency Shelter Team, or NEST, and I've spoken to you all before and elaborated on all of the housing challenges that we are facing both in Nome and the region, and have had the opportunity to give you that written report. So I won't elaborate, except on one point, which is I realize that there is a plan, an Alaska plan to address homelessness. However, it's built largely on the numbers collected from the point in time, which has been a very inaccurate tool for most of rural Alaska. And most of rural Alaska has no awareness of it or has participated at all. We are looking at HUD to revise how we can gauge homelessness for communities, smaller communities that would, I think, you know, if we could begin to count some of these people, 21 people in a small 3-bedroom house, as well as the ones in houses not fit for human habitation, you will see, and as we bring more small communities online with shelters, you've heard a lot of them today, those numbers for rural Alaska are going to astound you, because it is that big a problem, and I don't think it's quite been captured in the data that the plan is currently being built on. Okay. So that said, I wanted to actually offer something that I think would be beneficial to help small communities better help themselves. I would love to see, well, first of all, it's a no-brainer. We need a legislative committee on housing. Housing underpins everything else the state's trying to accomplish, from reducing recidivism to improving school improvement and everything in between. But then I would like to see the creation of, let's call it a Rural Housing Resource and Development Center, somewhat like the Alaska Small Business Development Center. That this would serve multiple roles, primarily, initially, information. That small communities have no idea how the housing world works. I've come to these meetings for years and have felt like most of the time people are speaking a language I don't even understand. And I know it's that way for others. If we had a one-stop shop where a small startup or communities could go and say, what's out there? How can you know, what's available? Here's our problem. What is there funding sources out there? I still don't know how we ever learned about BHAP, and CIMG was off the cuff in a conversation about something completely different, and yet without that our shelter wouldn't be funded. The communication center could also help connect other communities who are approaching them with similar problems for the purpose of sharing strategies. The Nest Shelter's been up and running for almost 10 years, and just today I find out that Ketchikan has a wet shelter that's been running for 10 years. Had no idea. At the same time, most of us here rely on BHAP, and Ketchikan's never heard of BHAP. So I think there's a critical need for an information center that encompasses all of the potential possibilities that communities could pursue. It would also be a way for communities to communicate back in terms of the point in time and help you get more realistic rural numbers. I would like this resource center to include some consultation where a community could invite a knowledgeable person like Brian Wilson, whom if I could clone 20 times over would fill the bill, and help a community. Nome is struggling desperately right now. Help them look at what their problems are, how can they, what funding streams are there that they could overlap, how could they begin to approach this problem, and then help them through it. Our rural communities, we're basically the frontline people. We may have a few folks with the capacity to do grant management, but when it takes Juneau, 10 grants to put a Housing First project together, we just don't have that capacity in rural Alaska. So I would like, if this center were to be able to provide some guidance and help us get through this process, as well as identify sources out there and how to leverage them, how to put them together. Additionally, a funders collaborative. If there was a way for grant funding agencies to combine their monies so that a community could come in and simply say, here's our needs, here's how we want to address them. And you be able to provide them the funding. But right now, the amount of individual requirements of each and every grant is a tremendous time sink. And again, we're back to lacking a lot of that capacity to do. Let's use the people with the passions where they're best needed rather than trying to turn them into grant managers. If that were not possible, then perhaps this center could serve as the administrative grant management hub for smaller rural programs that just don't have the personnel. Nest, to this day, we have a half-time director and I'm quarter-time. We don't even have an office, and we're 10 years into this. And we're trying to do COC, and we're trying to do supportive housing and rapid rehousing. And I think that there's got to be a new model, a more effective way to get these resources utilized in rural Alaska. And one last thing, and Eva, who just spoke, and other people in small communities have struggled with this as well, and that's startup funds, particularly where it comes to liability insurance. I got called a number of years ago by someone in Hoona. She needed a day shelter. She had people that needed it, people that wanted to volunteer, but nobody would give them space unless they could provide liability insurance. And when you ran on total volunteerism and no money for 2 years, but you can't sustain that. And so perhaps this resource center, as I envision it, could have a pot of funds to help a small community with startup, let them, so get them started, bring them in, and then help them get to a point where after a few years they are more self-sufficient. And in case I haven't beaten this horse to death, let me say, in final, that while I know there are not enough AHFC housing vouchers to go around, I still find it incredibly unfair that small communities don't get their per capita share. And perhaps this resource center could be a way. Surely there is a model where we can meet the HUD requirements using somebody other than an AHFC Section 8 office to do it, to where one housing voucher in a community can make a huge difference. I think that's it. Any questions?
Questions?
Yeah, I have one. Can you,
Oh,
why don't you think or why couldn't the Alaska Coalition on Housing and Homelessness be the entity that you're talking about?
Brian has been tremendous. And I don't think you would see the rural participation at this conference, which I haven't seen before, were it not for him. As it is, he's already doing 2 people's jobs. There is so much need for more outreach, more advocacy. He can't do it alone. Any more than that Small Business Development Center is a single-person operation who's also trying to run a business and do other things. That is asking just far too much based on what is needed. So no, I don't see the Alaska Coalition. They're our advocacy person, but he can't also be our mentor and guidance and everything else. So, his role was to get us here to share with you what else we need that is beyond the coalition's capacity to deliver.
So I'm going to push that question a little further. If there was additional funding for the state coalition, my question is, would this center be most effective inside or outside of the coalition's purview, from your perspective?
That's sort of like out of my pay scale. I think you would have to, like I said, Brian has been a tremendous resource. But I think we would have to look at what is the mission of the coalition and how much, I would be open to wherever it made more sense to put it, and that might be the most logical place.
Perhaps when Brian comes up here in a few minutes, we can ask him that question.
There you go.
Okay.
So,
Thank you, Sue.
all right, thank you all.
Back to public comment.
Public comment, or should Sean need to comment?
If you want to invite Sean up,
Okay.
and then public comment.
I understand Sean from Kotzebue also has a time issue, so if you'd like to come up and do your coalition presentation now, we'd be willing to swap you in. if you're still here.
Thank you. I didn't realize I was put on a list to speak today, but I'll do my best. Kotzebue faces a lot of the same issues that you heard about from Nome and you heard about from Bethel. We face those very same issues. A group of concerned citizens came together last winter and opened up a nighttime shelter with very limited resources, very limited money. Thank goodness for the Northwest Inupiat Housing Authority, who gave up space in one of their places to do this, to make this work. Otherwise, we have nothing. I mean, we're just starting out, but we have people who are freezing to death. We have people living in connexes. We have people living in shacks. We have people living in substandard housing conditions, just as everybody else is facing. I think Sue made some great points in being able to bring resources together. That's the only way we were able to survive on the shoestring budget we had last year, was the borough and the Native Village and the corporations came together and the city. I'm the city manager, and thank goodness that my council is supportive of that for me to be here today to speak. You know, that's how we made that work, and that collaborative effort is what made success out of what little bit we were able to provide. But it's not enough. And at a state level, I hope that we're able to bring more resources together. We're just starting out. We're just learning. We don't know what all the steps are. We don't know where to go find funding. We don't have showers to offer the people that are coming to the center to stay, for example. That's a huge challenge for us. We don't have laundry facilities to provide to clean people's clothing. The hospital, Manila Hospital, is offered to do our laundry for the bedding. I mean, and it's, you know, a lot of volunteer and a lot of community funds that are being distributed into this to try to solve a bigger problem. It's far bigger than what we're capable of doing on our own. So I implore state officials to please come up with a plan for solutions. Not studying, we need solutions. We need collaborative solutions to make this work. Thank you.
Thank you. Sean, if you have time, does anybody have any questions for Sean? All right, thank you so much. Carrie, do you want to take up the last public comment first?
Sure.
And jump back in?
So John Rossi, if he's still here, with the Matsu Coalition on Housing and Homelessness and Valley Charities.
Good afternoon. Thank you, Chair and Council. My name is John Rossi with Valley Charities. I'm up here representing the case managers of the Valley. First of all, thank you to AHFC for the money that you've given to us to help people stay in housing. What the case managers asked me to do is present to you some challenges that they have with helping people stay in their housing. Believe it or not, we have people that actually will turn us down because they'll not get their benefits if they do get help from us. We have folks that we try to get into work. We help them with that process as part of a contingency so that they can get housing. And if they get work and they reach a particular income level, well, they'll lose their benefits. So they're more apt to hold off and not want to get that assistance so they can continue getting their benefits. And that's a real struggle for us because we want to see people get into housing and stay in housing. Just recently been notified that the Energy Assistance Program asks questions about whether people have been assisted from other agencies or other churches in the community or around the state. And so we've been contacted, our case managers have, to provide that assistance with dates and times and amounts. And we've come to find out that it's actually served as a deterrent for them to continue getting energy assistance. So that's a struggle for case managers as well, wanting to help people maintain stable housing. As you know, in the Valley, we have a non-existent transit system, and we are facing even more of a challenge with DOT. Apparently, the Valley has lost out on the funding process this go around because the borough did not have an up-to-date transit plan. So we've lost out in funding, and we're looking at now 2019 to get transit funded in the valley, and that's a struggle. And we find that housing and transit are linked directly together in order for people to get to work and to get to affordable housing. So I wanted to make sure that that was brought to your attention, that that's affected us in the valley. The Alaska Housing and Finance Corporation adopted a program in the past, I think it was maybe 4 or 5 years ago, where they stepped people down from assistance. And I wanted you folks to know that we adopted that about 3 years ago with our funding from HAP and ESG and COC, and have found that to be extremely successful with being able to keep people in housing and also stretch the dollars that we have being able to use so we can help more people. So I wanted to make you aware of that. That program that you've been using is successful for us. I don't know whether you planned it that way, but it worked.
Can you
for us.
explain that a little bit more?
Well, what happens is we will fund 100% of somebody's rent to start out with. And then there's a contingency that we want them to show that they're going to the job center, looking for work and encouraging that. And we'll continue to pay a certain portion of their rent, depending on what the case manager feels that they can afford. And at the same time that they're looking for work, they're also saving money so that when the time comes, they can provide rent for their own housing. We get to a certain point, and the case manager will make a determination that they can be stepped down from the assistance. So rather than it being 100%, we go to 75%, 50%, 25%, and then they're funded on their own. It's that kind of process.
Thank you very much.
You bet. Thank you for the question. And lastly, just a question that the case managers brought up. We have a real struggle in the valley with getting assistance. As you know, we do not have shelters, and we're not advocating for shelters, but we use hotels to help with transitional housing to help and also help get people out of the cold. Well, we can't do that, but with only one hotel in the valley, and that's the Valley Hotel in Palmer, because the Salvation Army happens to have a board member that owns that hotel. We're asking, the case managers are asking if there's some way that we can have a bonding process, bonding, something in a bonding pool. And I bring that up because the only way that hotels will assist us is if we offer them a credit card. And we're very reluctant to do that because obviously of damages that could be incurred. And that's obviously why the hotel folks want this credit card. If there's some sort of process that we can take on through perhaps the funding we get through AHFC, developing a pool of funds that we would call a bonding fund, that we could then offer the credit card, and it would be up to a certain level that we would provide for any damages that may be occurred. That would help our being able to utilize hotels for the assistance, transitional housing assistance. Right now, it's just scattered site transitional housing. So with that, I think that's the end of my list. Any questions, or do you want me to jet out of here?
No, we have time for questions. Questions from the council? Thank you, John.
Okay, you bet.
Okay, at this moment, we're going to jump back into the formal Homeless Coalition updates, and we're going to go to the Kenai Peninsula next with Catherine DeLacy.
Mr. Chairman, while she's coming up to the table, could I share something?
Yes, absolutely.
I just wanted, the agencies that are, particularly the behavioral health agencies that are billing Medicaid for services to individuals who need housing supports, et cetera, they often use taxi cabs, particularly in the valley, to transport individuals to their offices for group therapy or whatever it might be, medications, et cetera, and are billing Medicaid for those taxi cab rides. And I just want to let people know that that is something that agencies can and do, and it's not cheap. We pay some cabs all the way from, for the Mat-Su, we've a couple of cab bills over $300-400. So we are looking at that, but there's a lot of, and we're not, maybe the $300 one is distressing, but for the most part, certainly localized cab costs at least allows the individual to get supports and get to their, and so, but just wanted people to know that that is a billable, as they say, service.
Thank you. Go ahead.
My name is Catherine DeLacy, and I am speaking for the Kenai Peninsula Continuum of Care. I work for the host agency, Love Inc. of the Kenai Peninsula, and I have to also say that I am a CICADA, which is Cook Inland Council on Alcohol and Drug Abuse board member. And this has been a productive year for us. In 2008, I was working at the food bank and started seeing people carrying in babies in blanket sleepers. That was my first exposure to homelessness because they were living in their cars. And because we're so far flung on the Kenai, it isn't obvious who's homeless. So it's a challenge. Last year, my agency helped 632 people and 160 households. And we're only one agency. We're probably the lead agency on the Kenai, but we've been doing the Project Homeless Connect, which I think has grown and grown and grown, and it's been a wonderful opportunity to educate the community. One of the things I saw in the last 2 years that was shocking to me, one assumes that if you come to the Homeless Coalition or the Project Homeless Connect, that when we're homeless, and I had several people say, oh no, but I think I'm going to lose my job. And so there was a spirit of fear, which I had never seen on the Kenai. And so they were trying to prepare for that eventuality. And of course, given our economy now, it's happened. Our coalition has been through the paces. We're growing. And Project Homeless Connect has probably helped that because we've drawn people to the coalition from Project Homeless Connect and much community support. I told the previous group that we had so many volunteers we had to turn people away, which was the good news as far as acceptance of the issue. Some of the really good things that have happened this year was our local hospital opened up a 6-bed detox center, and we deal so much with methamphetamines and issues of that nature and heroin that it just is a godsend. As a CICADA board member, I used to have to beg to try to find a bed for anybody just to detox they could get into treatment. So this is just going to be, I believe, incredible for our community that we will at least have that facility. Again, with behavioral health and addictions, we have 3 women in our community separately who decided that they wanted to do something and opened up 3 different facilities. And it's for people coming out of treatment or out of corrections and wanting to do something with their life. And I'm so proud of them. I still have a lot of fear for them because of the ongoing cost of doing such a thing, but it's such a passion they have that it's good for everybody to see that we are stepping up. But as I said, when we started out, I went to ICER, and they said we had 500 or 600 homeless in 2008. And it has grown substantially. And we're a second-class borough. Nobody keeps track. School district probably was as close. When we got into the BHAP, we did the HMIS, so that's helped. But it's really difficult when it's so huge to know the numbers. And our coalition, we discuss a lot affordable housing, and we know that's on the list, the wish list, I guess, because we don't have enough. Nobody does any place in the country. The one thing that I see that hurts the Kenai is we have no emergency shelters. And so starting about October 1st through April 30th, you just pray that no one dies, because that's the reality, because there's no place for them to go. But we work on that, and we're talking with the churches now, and there's been expanded interest, and they participating in a rotating cycle of providing housing, emergency housing. But I'd like to say to the council, thank you for listening. I've been a legislative research analyst. I know what you're dealing with the finances. And the one thing I would say is that I think we would really benefit from having a subcommittee on homelessness with the legislature, some portal where even all the communities would have some place to contact. You could have better knowledge of what was going on. And it just seems like a reasonable thing to me. And in my second-class borough, if I can say to my mayors and my borough mayor, well, Juneau thinks it's important enough that they now have established a committee for that purpose, I think that would be really helpful to me, because I try to convince them all the time that everybody's a resident. And so, but I appreciate your efforts, and I also am in sympathy with your problems. Thank you.
Anybody have any questions for Catherine? Hold on one second.
Can I ask one? I actually had two. In your report, you mentioned the Indigo House it just opened?
Just opened.
And how was is that one of those homes that
they're just opening the
friends
doors and taking donations from the community. Freedom House was one of the examples of, I think within 4 months they had 75% of the money they needed. So again, that's a real positive for the community to see that they can do it.
And do you think that the 6 beds at the hospital for withdrawal management is having an impact?
They've been full ever since they opened up in August. And literally, I would have to almost bend the truth to try to get them in a bed any place in the state. And I'm sure you're aware that if they decide they may want to go to treatment, you maybe have 12 hours to get them in any place before they'll change their mind. So we see it as a godsend.
I would just like to share, this is funding that the legislature gave to the department 2 years ago. It started out at 31 million and then was reduced by the legislature to 11, and then the governor took 5 more, so it was $6 million. But we did offer it up to communities, and Soldotna and the hospital chose withdrawal management, and here in Fairbanks they're doing a sobering center. It, however, encountered a lot of not in my backyard issues, but I think they may have opened this month, like a week ago. And then Matsu has a facility for pregnant women and children. So, and that was all funded with that special appropriation from the legislature for 3 years to a year ago.
Thank you.
I guess I would like to add one thing, is that the borough has 4 small first-class cities and about a dozen unincorporated villages, etc. So I understand the concern about, and it would be also helpful if the council or the legislature indicate what they think should be the priorities. I worry about things being from one place together and what's provided, but I think that would be helpful. And I think, again, this subcommittee would be a vehicle to do some of that stuff that would be really helpful. Thank you.
Thank you. Brian Wilson, you're up next.
Can we put Mike, is it Mike Sanders? Yeah, Mike Sanders next. I'm sorry.
Sorry.
We have some other presentations going on and tours and such, and they're just trying to meet those commitments also.
How's it going, everybody? I'm Mike Sanders. I'm the Housing and Homeless Coordinator for the City of Fairbanks. Just to touch on something you mentioned about the sobering center, it's not quite open yet.
It is.
They're very close. They have a few hurdles that they're going over right now. They have to get everybody medically trained, and they have a few things that they're still working on. They'd planned on having that as having their open house today, or actually tomorrow, to coincide with this event, but they were unable to make that deadline.
Thank you.
All right, so here in Fairbanks, at any given time, we have about 250 folks that are homeless. Most of them are in the emergency shelter. About 170 or so are usually in the emergency shelter. We have some transitional programs, and then in the wintertime, we still have about 30 folks that are completely unsheltered. I know last time I was here, I talked about how one of my first weeks on the job, we went out and visited the camps, and I was I was coming up from Texas, and I was just blown away about how it was negative 30 out, and we're walking through 2 feet of snow, and there's people living in cardboard boxes and tents, and that's still happens now. We have about 13% of the state's homeless population. And in the last year, we've seen 1,526 unique individuals receiving services. Out of that, 1,172 were adults, 354 were youth, and 70 were unaccompanied youth. Fairbanks receives about 40% of the balance of state COC funds, which is about 8% of the overall COC funds for the state. Overcrowding is a problem here as well. It's about double the national average, but it's nothing compared to some of the more rural places. All right, coordinated entry. The last time that I came and testified for the Governor's Council, I wasn't sure about coordinated entry, how it was going to go over here in Fairbanks. It was still at that, just 6 months ago, it was still kind of a touchy subject to say the least here. But since then, things have really turned around. I'm super happy and proud of the community for coming together on a coordinated entry. I believe on my update that I sent Carrie, I actually had a mistake in there. I had said that all of the required folks had already signed. There is one outlying agency that hasn't signed yet, but they are in the process. They should be signing. All right. The rescue mission just recently did a trial of the various assessment tools for the balance of state, and fortunately they came up with the VSPADAT being the most accurate and the most user-friendly. And the reason I say fortunately is because that's the same assessment tool that Anchorage uses. And for the balance of state, I know Brian will probably talk to it more, but it'd be great if the entire state at some point had data sharing and the ability to talk to one another. All right, Fairbanks is also close. We've agreed on an ROI. We think our ROI will be very similar to Anchorage, and we strongly advocate for the balance of state to adopt an ROI that's similar to Anchorage's as well for the same thing, for the statewide data sharing. We're working on how our referrals and case conferencing will look, and how our move-up strategy will be for individual folks. The great thing about the case conferencing is that we already have a couple organizations here in town that are also looking to do the same thing. The Reentry Coalition is looking to have case conferencing, and the Interior AIDS Association just got a grant for opioid treatment, and a part of that grant is involving case conferencing. And because Fairbanks is kind of a small town, these three organizations, it's the same people traveling in the same circles. So the case conferencing for coordinated entry should be pretty simple for us to accomplish. All right, and then the last big thing that I want to talk about for Fairbanks is everybody heard Mayor Castle earlier today talking about how when he first was elected that he wanted to do a summit for Fairbanks on homelessness, and because we're in a second-class borough, he didn't have that authority, and the city is a home rule city, and even though I'm a city employee, they made a distinction with my position that I would be completely independent, so that I'm not burdened by the same constrictions that they are. So on my nonprofit hat, we're allowed to do a symposium. So on December 6th at the Westmark, we're going to have the Fairbanks Symposium on Homelessness, and it's being co-hosted by FNA, Fairbanks Native Association. We're super proud about that. And the whole focus of our symposium is we're taking the Alaska Supportive Housing Plan, and I'm sure, as you all know, it's the first half of it is like the best practices, and this is what permanent supportive housing looks like, and how to do this, and the different funding sources that are needed currently. And then the second half is all the legislative stuff, which we strongly advocate for as well. We definitely agree that there should be a legislative committee, and that we cautiously advocate for a consolidation of funding sources, and we advocate for the state housing trust. But we're going to focus on that first half of the Alaska Supportive Housing Plan. And really what we want to do is we want to figure out how we can get more rapid rehousing and more permanent supportive housing going on here in Fairbanks. We already have some permanent supportive housing, and we have one rapid rehousing program here in town. The rapid rehousing is doing very well. The permanent supportive housing is doing really well as well. However, the need is so much greater than our current capacity. So we're really hoping that on December 6th we can get together as a community and really break down that plan and figure out how we can get more of what we need to end homelessness here in Fairbanks. And with that, I'm ready for any questions.
I just had one about, are you bringing up someone from the TAC for this purpose?
Yes, TAC is coming. They're bringing up a few folks. They're going to help facilitate the entire event. So we have TAC and 4Acre on board. Let's see, DOL, DBH, TCC, DVR. I think we have a lot of the right AHFC. I believe we have the Mental Health Trust just told me today that they'd have folks there too. My understanding is, we're going to have the right people in the room. And everybody that's here at this conference is more than welcome to attend. It's a free event, and as long as you register before November 1st, because of some requirements after November 1st, we have to charge $25. But it's a free event. It's one day, and it's going to be a work session. It's not going to be there's going to be talking, but it's going to be action planning.
Okay, thank you, Michael.
All right, thank you.
Carrie, is Brian next? Okay.
Thank you, Council, for, am I on? Speak loud enough. You know, one of the nice things about having the council meet at our conference is I get a lot of mic time.
You have 3 minutes.
So 3 more than I had. First I want to just thank the council. 6 months ago, we came and spoke and put down some pretty serious asks of the council to really look at what role the council's playing and what we could do to work better together. And it's my understanding that there's actually been a few meetings on separate occasions, and I know that we had the opportunity to sit down with the governor as well. It was interrupted a little short for issues outside of our control, but I feel it's a real positive step forward in this dialogue. And I feel like at this conference, you've heard it pretty clear. Communities are doing an amazing job with very little resources. Shelters with less than 1 FTE, communities piecing together 10 different funding sources to open up 32 units in Juneau. They've improved our ability to report on homelessness and where the need is in our state in ways the state has never seen before. We as a coalition have made it a priority to be as transparent with our information that we have. We don't own that information, and I really encourage every council member to frequently visit our data website and utilize those dashboards. It was just updated today to the third quarter numbers of 2017. It's quarter to quarter comparison going back for a year and a half. That's a resource that not a whole lot of COCs across the nation have, based on my conversations. So please utilize those. But I think that it's really important that we never forget the service gap that exists in our system. We are doing our best to follow best practices and follow HUD guidance to improve the way that we deliver and allocate resources in this state. I can't say it enough. When we press the button on coordinated entry and we start utilizing common assessments across the entire state, it's going to become even more clear that we have nowhere to refer individuals for the majority of our state, where folks are presenting in communities where their closest intervention is over 1,000 miles away, not even connected by a road system. We really need to keep that in focus. We aren't doing our job. And so I think a big step in this, and I mentioned it this morning, is communication. The communities are doing their best to communicate through data. We do our best to communicate to the council twice a year, more than twice a year if we can. But at the legislative level, I feel that there is no ability for communities or for advocacy organizations or for agencies to communicate on a routine basis to our state legislature. Housing is brought up in every community that I visit, not just because I work for the coalition, but because every community is really struggling right now with a lack of capacity. I feel like this council is very well positioned to recommend a legislative committee or have housing and homelessness assigned to a current committee at the legislative level so we can have this dialogue happening, because a lot of what we need to see in the future would require acts of our legislature. I mentioned this before, and several communities have mentioned this. They're doing the legwork. They're learning about best practices. They're putting together project proposals, and they're having a hard time accessing any funding to get those up and running. You know, our COC competition, grant competition, has become increasingly competitive every year. This year we received 4 new project proposals from communities. It wasn't a surprise. We've been really working hard with them to learn about what they need to do to address homelessness in their communities. And unfortunately, we could only recommend funding for one of those new entities, not because they weren't good proposals, but just because it's really competitive. And we could only recommend funding for 50% of what they asked. And that wasn't new programmatic money. That was a reallocation, a really tough decision that our coalition had to make. So it's not really a plus gain in our eyes. And so I know I'm not, I don't want to get off the impression that I think that everyone at this table is sitting on a pot of money and not allocating it out to the community. That's not what anybody thinks. I don't want to give out an impression that you aren't doing a great job with the resources that you do have. It's very limited right now. But I do want to say that every entity here is trying to address the same population. It just makes a heck of a lot more sense if we could create a funders collaborative as recommended in our strategic supportive housing plan, which brings together multiple agencies and private foundations to have the discussion of prioritizing our goals in addressing homelessness and finding opportunities to leverage those funds and make it easier for communities to access these. And I'm not saying this as an outsider. We are one of those entities that manages a fund that's identified in there, and we would love to sit at the table and figure out how communities can access BHAP funds with COC funds in a very easy way, or leverage against home funds or whatever. It's just that connection, we're leaving that up to communities that don't have a whole lot of that knowledge to figure out that problem. And if it took the chair of our coalition 5 years to put into place 32 units in a community, what answer do we have when we go and give technical assistance to a community like Ketchikan that's never heard of any of these funds or never even spoken to somebody that works at AHFC or the trust in some cases? I think it's unreasonable for us to think that that's something that can happen. So we've talked about, Sue talked about how we need to really build our capacity to, increase the knowledge about these funding streams in communities, and I totally agree. But that cannot replace the funding piece of there. If our coalition were to ramp up our staff and be able to do that in a more effective manner, we need to have something to tell them in terms of how do they access these funds, because I'm just not seeing a whole lot of new programmatic money out there. And I don't think that creating a funders collaborative would necessarily create this new programmatic funding, but it could find some efficiencies in our process. And then finally, I think this council is very well positioned to begin the dialogue about creating a new funding source. We're one of 3 states in the entire nation that has no state housing trust fund. I don't know why that is, because it sure isn't for a lack of need out there. And it's tough right now in the legislature, and I understand in all your positions, I've worked in the public sector as well, that it's not a fun thing to go to your elected officials and asking for money when you have nearly a 50% budget deficit in your state budget. But these things will take time to plan out, and if we don't start now, really the only people that are suffering are our clients. Because eventually we're going to have to address this issue. I don't see any other way about it. So if we start now, then we could be prepared in the future. If we wait 5 years, then it could just be another 5 years after that. So I'll leave my comments for that. I'll probably make some more, though, if there are questions.
Questions for Brian?
So I'll ask you the same question, Brian,
Sure.
that I asked Sue. The three initiatives, you think that the council is in a really good position to encourage, move toward. The legislative committee, I understand that would be a legislative thing. But this funders collaborative especially, do you think that's best outside of the state coalition, or do you think it could function under the coalition's purview as a committee?
Quite frankly, I don't really care what it would look like.
You don't care?
Yeah, I mean, honestly, it would require all the same people at the table. So whether we're facilitating that conversation or HFC is, it's still the same people around the room. So I'm totally fine with our coalition taking on that. We would need additional resources.
Mm-hmm.
I mean, it's just me right now, you know?
Right.
And you know, I'm proud of the work that we have done as a coalition, not just me, but our board members, in getting this level of engagement. People flying, you know, a long ways to talk to you guys and to network. And so, but it's not sustainable right now. And so if it's a couple staff members or if it's assigned staff members at HFC or in the trust or DHSS, it doesn't really matter. But what matters is that all of these entities, plus additional Rasmussen Foundation, the Anchorage Coalition Board, they all need to be at the table.
Right.
Yeah.
Right. So then the second question is, and I may have misunderstood something that our plenary speaker shared today, but I thought for sure I heard her say that $3 million of the National Housing Trust Fund flowed our direction as a state. Is that accurate?
Yeah, that's accurate.
What
in
happened
fact,
to it?
Mark could probably talk to.
I'm sure that the money under the National Housing Trust Fund, which is funded from the proceeds from Fannie Mae and Freddie Mac, comes to Alaska Housing.
Okay.
And it's going out as supportive housing assistance for development.
Okay, so it's being used.
It's being used, yeah.
And did not, okay, thank you.
And I think we have one more allocation coming, and I guess it's anybody's guess whether Congress will continue to fund the National Housing Trust after this fiscal year.
Thank you.
Any other questions for Brian?
Sorry. I wanted to ask, as far as the advocacy piece that you all have been doing, I know that you've gone to Washington, D.C. every year and really gathered some national advocacy pieces. Can you, and Diane's presentation was fantastic. How are you blending that with your state advocacy?
Sure, that's a great question. So we're fortunate enough to receive grant funding from HFC and the Trust every year to fly a contingency of Alaskans to the national conference. I act as the state lead for that with the National Alliance to End Homelessness. Every year they have a Capitol Hill Day. And we really, for starters, rely on our state partners to help. They do an amazing job of saying, you know, here's your federal delegates, here's what boards they sit on, here's the important issues nationally that they would have some influence on. And so we use that as a starting point for our federal advocacy, but we really utilize the feedback that we receive from communities and the data that we have to basically display the need that we have there. You know, a lot of the recommendations that came out of the Governor's Council are solvable at the state level, but there are some that need federal assistance. So, for example, this last year we spoke quite a bit about the federal definition of chronic homelessness and how that doesn't apply to rural areas to all of our delegates, and they all agreed. We talk about challenges that we have in our SOAR process for folks accessing mainstream benefits and some of the challenges they're having for appeals to that. We have a 0% approval rate of appeals in our SOAR process right now, worst in the nation. And so we talk about that and some of the challenges that, and some of the things that they might be able to do to help with that. So that's really how we approach it.
Thank you, Brian.
Thanks, Mark.
Next up, we have Mandy Cole from the Juneau Coalition.
Thank you, Council.
for the chance to speak today. I am Mandy Cole. I'm from Juneau, and I've been co-chair of the Juneau Coalition on Housing and Homelessness off and on for about a decade. And I am hopefully going to switch out here again soon, but I thought I would give you kind of one of the summaries of one of our best years so far. I know that everyone has mentioned that we opened a Housing First facility just this year. September, we welcomed our first guests in, and it's been amazing. We established with community support a primary care and behavioral health clinic within the Housing First facility, so every one of those 32 people will have access to free, available health care and case management and behavioral health support. So we're super proud of that. It's the first in Alaska. One of the things that we learned, however, in establishing the Housing First Collaborative is that projects of this magnitude, even for a city that has resources and is organized like Juneau is, was very difficult. And it sounds like many of my colleagues have talked to you a lot about the funding collaborative idea, but what I want to tell you is that in this fiscal climate, there may be less money available for building projects, but there are also people doing more work than they used to with less money, which means there's less availability for someone to just pick up the phone and call Daniel Delfino or anyone other expert who can give advice about how to put these funding packages together. And so while yes, the money is important, it's also really important to have direction layered with expertise and to make those things available for projects over time. Because without that, the money is important and we need it, but you also need to have help sometimes establishing how things fit together. And so I wanted to just kind of add that to my plea for the Funder Collaborative, wherever it's located. Juneau also wanted to bring to your attention that as we move closer to providing supportive services with our permanent housing options, whether they're scattered site or in a kind of single facility, we also need help as communities to bring all of the needed resources together. So I ask you to think, if we had all of the money that we needed, would a perfect solution to this be that every shelter and every housing provider had its own staff of case managers? It might be a perfect solution, but we would be duplicating many efforts because people need help from different places. And so part of what I think is important as we move forward in co-locating supportive services and housing is to really have a plan for how each community wants to do that. Does my emergency shelter need 10 case managers for 100 people? Or does my emergency shelter need a housing support specialist and a collaborative agreement with another behavioral health provider to provide case management services? And I think that we all know that collaboration is the way to go, but what we need is facilitation for that collaboration, because we're all trying to do our best with what we've got and our own dedicated funding streams. So what I imagine is that as Medicaid becomes a source of payment and as housing supports are tied with housing resources, with rental assistance, things like that, that we need to work together in order to make models that communities can follow that make sense given the resources that we have, rather than inventing everything from the beginning each time a community wants to build a supportive housing project. And then finally, I wanted to talk to you about the idea of it's pretty distracting.
It's off, but somehow it's still ringing.
Also, I wanted to just finish up by talking to you about the this is a human-driven process, and the people who work with persons on the street, whether they're doing outreach or they're doing shelter work or they're doing supportive services work, they're special people who spend a lot of time and energy trying to make things work for people in difficult circumstances. And I know in Juneau we have a difficult time filling positions. And I think I've heard that echoed in other places as well. And so part of my request to you is to consider that while this work is difficult and while funding is difficult, in order to get it done, we have to have kind of the human element to do it, and we have to be able to pay the people who are doing housing living wages to do housing work. The irony there is that if you need support to maintain your own housing while you're a housing specialist for others, it's not fair and it's not right. So thank you very much, and I really appreciate my time here.
Thank you, Mandy. Any questions for Mandy? All right, thank you. Let's see, next up we have Dave Rose from Mat-Su Coalition.
I'd like all of you to take a minute and stretch and roll your head around like this. I thought about bringing a hammer up to remind you that it takes a hammer to build a home. And I hope you don't feel like we're using the hammer for something else to get your attention on things. And I have a question for you. Mr. Romig, I suspect that that's not allowed, so I'll make it rhetorical. What can we do to increase Mr. Burns' funding? What can we do to influence Juneau so that instead of going from 31 million to 3 million to possibly 0, we turn the corner, turn the ship, and impress upon whoever that we need more funds, not less funds? Because we all need to support you. Because without Alaska Housing Finance Corporation, we will have nothing. If the rest of us could imagine this meeting is canceled because each of your agencies were determined to be easy budget lines to erase, and now we've got the budget deficit down to whatever billion, yeah, maybe we'd have a balanced budget. I doubt it, but maybe. But at what expense? So I know you can't tell us, but we need to research what can we do to maintain and/or increase funding to you all, because we rely on you. I got churches working with me, I got individuals working with me, I've got a coalition of agencies and organizations, and together we do a wonderful job, and we're lucky because we have the Mat-Su Health Foundation, and they've got enough money that they can be generous and support community initiatives, which is awesome. Not every community has that. But even that is limited to $20, $80, $100, $200, $300,000, depending on the project, depending on the scope, depending on the need, depending on the ability to convince them that, yes, this is something worth funding. Excuse me, but that's peanuts. You guys in the past have had $25, $50, $100, $150 million to help people across this state. I'm a fiscal conservative. I probably sent some of those people to Juneau. They got the wrong message from me. That's not why I sent them to Juneau. Yeah, I want a balanced budget. Yes, I want things to, you got to balance your budget. You just have to. But you don't put your kids outside in a tent to save on heat. You don't sell the house to live in the car if you can at all figure out a way to do it so you can keep the house too. We need more jobs, we need more people working, we need things to turn around. As a state, we need to recognize and find other sources of revenue perhaps, carefully and cautiously, but we need to keep you guys in business. So with that, I'm going to also highlight what we've been doing. But we've only been able to do this because you guys have helped us, okay? This graphic talks about the number of people we served. It talks about the number of services and the average assistance of all of $444. That's the average assistance. But you know what that does? That keeps people in their housing. It keeps them from living in a car or doubling up at their friends or family or neighbors. It keeps their record clean so they don't have a court view eviction notice on there or a small claims court claim against them. Because landlords look those up. Landlords are risk adverse. Again, I'm one of those landlords. But I'll take a chance every now and then. Well, that $444 probably saves that family $2,000 because then they can stay in the housing, they can get the new job if they lost the old one, they can fix the car so they can get to the job and continue to work and not have an interruption in paychecks. That's what that really represents, is that bump in the road that we helped them over. Thank you for providing the assistance so that we can do that. You'll see a number of services that we offer there on the right-hand side. You'll see on the opposite side reasons for homelessness, reasons that they do need help. We don't usually list it. In fact, we don't help people who would present the reason for homelessness as they scam somebody or they lost their money on a drug deal or they lost their money because they just squandered it on alcohol. We don't list that because we don't help those folks. Unfortunately, those folks fall through the cracks. These are the folks who missed a week of work because they got ill. And when they missed a week of work, they missed the paycheck. So those are the reasons that we deal with through the Homeless Assistance Program, through the Emergency Solutions Grant, and through the Continuum of Care program as well. And I have to tell you, my boss is probably going to give me a hard time on this one, but that's all right. The coordinated entry, we're moving along on it, and we're filling out the forms, and we're doing it the right way, but it scares the heck out of us because we haven't worked with those people as much. Anchorage, they've worked with those folks. The impression is they understand what's involved and it's a part of the plan. We have a couple of Housing First programs and projects, but that's not our comfort level. That's not where we're at. So that scares us a little bit. But we're going to be ready, and with those funds, we're going to do the best we can because we also recognize those folks need housing too. We're going to do what we can, but honestly, it's a little scary. If you look at our MATSU agencies, the agencies these are just the folks participating in the Homeless Assistance Program grant with us. Okay, these are not all of the agencies working with us, but that's what that is. And if you look at the demographics, age and race-wise, gender, disability, it looks a little bit skewed. 78.5% of the folks we help are white, Caucasian. But if you look at our 2010, was that the most recent census, U.S. Census? Yeah, that's our demographic. That's who we are. So it's in line with exactly who lives there, is percentage-wise, those are the folks that are getting help. And I'm happy to say we're getting more and more folks from the Alaska Native community stepping in and realizing that we have this resource, and we're helping them as well. I was going to go through my 11 pages, and then somebody reminded me that you have those in your notes. And I've actually talked from a couple of you that you've actually read them. Thank you. Wow. You guys need a pay raise. Three things, and then I'll be done. We do landlord luncheons. We've done 3 of them. We had our second one last spring. Great way to engage not just landlords, but out in the valley we have property management businesses, okay? And the folks working for them need to know what's available and how we have people to place and we can support them for a little while. That's been helpful. We also just recently did a Valley Pastors faith-based community. Let us tell you what it is we do with housing so we can help you stretch your dollars further. A lot of churches, a lot of faith-based organizations will have benevolent funds, and then they might have $2,000 in them. They might have $10,000 in them, but they can help like $100 at a time. So we just thought, let's get together with them and tell them what we can do so that their dollars are stretched that much further. And it's a little bit selfish also because it gets the word out, community awareness is raised, but also then there are some things we can't do. And we want to be able to call them up and say, can you help this couple? Can you help this family? Can you come alongside this son or daughter that needs some mentoring? Because there are some things we can't do that they can do. We had 16 people show up at that. And a couple of the deaconesses that showed up were like, wow, thank you so much. You gave us the words to give people hope, but yet at the same time, hold them responsible or show them the path to self-sustainability. Because that's really what everybody wants. They want to be independent. They don't want me telling them what to do or you telling them what to do. They want to be independent. And in order to truly be independent, you need to be self-sustaining. That, I guess, in a nutshell, is what we're trying to do. John Rossi came up and told you the 3 things he told me to tell you earlier, and I forgot to tell you, so that's covered. Do you have any questions?
Questions for the Metsu Coalition?
I have one. Can you just briefly tell me about your work with Jack Hebert and the co-climate and sort of what's happening there, if anything, if it's continuing?
Thank you. Mr. Dave Kuiper is also a member of that subcommittee from the state coalition. We are in Representative Young's office. He repeated it 3 times that, boy, somebody ought to be doing something with container homes because that's the wave of the future, tiny homes. Jack Hebert, I contacted him, again, at Representative Young's suggestion. We've met with him. He has put together a 2-page proposal to look into it further, basically. He thinks it is doable, it is possible, but he needs to go a little bit further with it as studying it as to what the proposal will be. So we're working on saying, no, we want you to be a little more specific, what actually could be done. And I would like to go back to Representative Young's office, because he promised to find some money for us if we did this, and ask him, we'd like $150,000 or $300,000, and we're going to approach 3 communities, and we're going to produce 6 homes and deliver them to those communities and see how it works as a pilot or something like that. That's basically what we're trying to do there.
Thank you.
Yep.
Great. Any other questions?
Just one.
Steve.
You didn't want an answer, did you, to the question that you asked?
Only if you can.
Well, you've already started with what I would suggest. The more, at least it's my guess, is that the more you can tie this kind of thing to dollars saved will help us make the case.
Okay.
I think that's the deal. Or at
Steve,
least
did
part
you-
of it.
Thank you.
Steve, do you have a question?
Yeah.
Hey, Dave. Steve Williams with the Trust. Thanks for your presentation, and thanks for all the folks who've taken the time thus far, and probably everyone else who will come up after you to present. You did ask the question about what you could do, and Dave kind of jumped on it a little bit, but I'd like to add a couple of things to what can be done to kind of further the awareness, the education, both at the local level, but also at the state level, which is to do exactly what you just did. I mean, you provided at the very beginning a concise, data-driven message about an issue, and this can be any issue. We're talking about housing and homelessness today, but it's any issue, and how it's impacting the local community, what the local communities are doing to try and come up with solutions and meet part of the need, but are now looking for additional assistance and support from other entities outside their community, in this case, the state. And you spoke specifically about the legislature. And how do we ensure that, or try to ensure that the resources that the state has at its hands are used in the most effective way and serving the greatest needs? That's a tall order because there's lots of needs statewide, and everyone thinks their particular need is the greatest. But at the end of the day, really the greatest need is in my opinion, making sure that our communities are addressing the needs of the most vulnerable people in their community. And you know, the Matsu Housing and Homelessness Coalition's doing that, and other entities, and you're partnering to do that. But in order to ensure that, we have to communicate why that's important. And someone spoke about it earlier this morning, and a couple people reiterated it, and they were talking about prevention. And you mentioned making sure that people had a safe place to live. And that translates at the child level. It's important, and it's important so that kids feel safe in their home, they can do their schoolwork. That translates into better outcomes in the school system, which translates as the kid moves through, and I know I'm speaking to the choir right now, but which translates into being productive out in the community, which decreases risk for contact with the criminal justice system, which leads to someone actually being a productive member, either through volunteer or employment in their community, and then being productive in the state. So what I just described was what the governor's kind of theme, three-word theme is, which is smarter, safer, stronger. You know, those are really key, those are the key elements. If we start focusing at that level, we'll start seeing the outcomes. Granted, it's going to take time, but we'll start seeing our communities really being healthier, safer, and stronger. And then the other piece to this is always comes down to, you know, a dollar sign, or people like to focus on the dollar sign, but the dollar sign's not the end-all be-all, but it's important. And in my personal opinion, and I think many folks would agree anyway, and which is one of the reasons the legislature is having a special session right now, is that the state needs to focus on a long-term state fiscal plan. And that can take many shapes, it can take many forms. But unless the Alaskan community is communicating that to the legislature as a need that they want to see their elected officials make a very difficult decision on and take action on, it's not going to happen. So the key point to this is that we need to get people educated about the issues and then make sure that they're contacting their representatives to voice those concerns. And you gave a very excellent example of that at the very beginning, so thank you.
Thank you.
Thank you. Next up, Dana Myers with Kodiak. Is Dana still here? She probably went on to another session. So that leaves the Anchorage Coalition to End Homelessness. Christy Duff, you are up.
Good afternoon. Can everyone hear me?
Yeah.
My apologies for missing a portion of the earlier updates. I had a call scheduled. But what I've been hearing throughout today, and a lot of our themes are focusing on what we still need in our communities to address homelessness and the challenges that come with that. I think that my report captured a lot of those. I could touch on them if the council is interested, but I would also like to focus on some of our successes and where things are coming along that I didn't maybe expand on in the update earlier this morning. I think that we're hearing probably in general that a lack of treatment services, substance abuse treatment services statewide is a real challenge for us. That, in addition to a lack of case management resources in Anchorage, are affecting our ability to reach all of our clients needing housing and helping them stay stably housed. That's a key piece with the wraparound services. Once we can find clients and have them in housing, but if they don't have those ongoing supports, it's difficult for them to be successful. We're also seeing, and I won't get too much into this, I know that Nancy gave an update earlier about the mayor's office and the efforts that is going forward with the Muni. But we are seeing an increase in crime in Anchorage. There's a lot of discussion around it right now, and there has been rhetoric, if you will, trying to link that increase in crime to homelessness, despite there being a lack of evidence to support that. And I think funding overall, we're seeing it statewide, but it applies to Anchorage as well. The ongoing needs that we have, a lot are driven by a need for those funding resources, and we have a gap in being able to provide those services when we are short on some of those funds. In spite of all of it, we're making a lot of good progress, and there's a lot of exciting updates that I can give. We talked about the coordinated entry program and housing placements to date, so you have those numbers available. But I would think a lot of that success is due to the community collaboration that comes through coordinated entry. When I started a year ago, I was going around to providers and trying to get some information from them, and I had someone flatly tell me no one wants coordinated entry and no one wants to do it. And I've continued to see that resistance in some ways, but largely it's been a very good effort to see the providers come together. And it's difficult when you've got multiple funding sources that sometimes have compliance that conflicts with other funding sources. You've got different missions, you've got different populations you serve, and to watch really good people who work very hard for this cause come together it's very exciting. And as the coordinated entry manager, prior to moving into this position, I'd go to all of those meetings, I'd see how this works and the similarities and differences in all of our populations. And it's very exciting to see that come together. We're still, through that process, finding ways to grow and implement the program and brainstorming that through our oversight committee. I'd also say that the coalition in general it's a really exciting time. We're building our capacity, we're growing. There was about 8 or 9 months where there was no director. Now that director position is filled, the coordinated entry program manager is also a coalition staff member. So prior to that, there's only been 1 staff member. Now there's 2 for the coalition. We're also working to bring the transition coordinators who are mentioned in your report under the coalition in terms of supervision and program management. There's still different fiscal agents in the community that manage them as the employer of record, if that makes sense. But we're consolidating our resources, coming together, and an office move that'll take place at the end of this week will bring us all together into one spot too. We were previously scattered throughout the community, and even though we were working together, it does present a challenge when you're kind of parceled out in the community. We also had the opportunity, we had a temporary contract. It was about 6 months for mobile outreach. We're finding through either assessments in the community, the most recent point in time count, and other efforts that we still have a large portion of our population that does not come to any of our agencies for services. So we're hoping to find another way to use the mobile outreach model that we did previously to fund a position like that and keep someone that can go into camps along with our social worker that's embedded with the camp or the CAP team. This person also would go to places in the community that don't participate in HMIS or are not as involved and collect data. They would also go to the library, for example, and other resources in the community that we see being impacted by our homeless clients, but those clients that don't necessarily go to Beans or Brother Francis or to the Rescue Mission, kind of places around town. And as the coalition grows, I think it's very exciting. Our membership committee is really looking for ways to be creative and broaden our membership and interest. Right now, the majority of our board is comprised by social service providers, which we have a lot of great minds in the room, but we want to diversify that and seek opportunities to grow that, because this is, it's an issue that's pressing on all of our resources in Anchorage and the state, not just particular service providers. And I'd also say that our Education and Advocacy Committee is reinvigorating their strategies and how we can advocate in the community, but also bring a certain amount of education. I think there's a lot that's getting lost maybe in what we read in the paper, other discussions, and what's truly leading to the impacts that we are facing and how we resolve those. Questions?
Randall?
Yeah, can you, you mentioned that the Assembly, in your report, you mentioned that the Assembly had requested that a mapping of low-income and multifamily housing by census districts be completed. Are you all is the Assembly working on that?
Yeah, I was just looking at Nancy. There was a meeting last week, and so the mapping is a generalized area of where you would find either services in the community or housing, but it's not specific client locations. That is something we cannot do through HUD.
I was just wondering because a couple of cities have been using geomapping to identify where they really need to put their resources, and I'm wondering if this is sort of what you're trying to get at.
Yeah.
Yeah. Okay.
Yeah,
Okay.
and that it's. I was trying to include some of the mayor's initiatives in this report, but did leave the update when Nancy
Okay.
gave her testimony. But yes, that is that is the spirit.
Cool.
of
And
it.
then is there a reason why the fiscal agent that NeighborWorks is no longer the fiscal agent?
It was a temporary, well, so like I said before, the prior coalition director, she gave her notice very early but left in December or so of last year. And in that planning process, I think the decision was made knowing there wouldn't be a director, or also kind of how that was, but all positions were scattered in the community, and we rolled it back to the coalition this year.
Thank you very much.
Any other questions? Well, thank you so much.
Thank you.
So next up on the agenda is Colleen Dishkin with the Association of Housing Authorities. And just to let everybody know, I'm going to use the discretion bestowed upon me as the chair to power through the break. And so if you need to get up and use the facilities or get water, feel free to do that.
Oh, they have copies of the. Okay.
Are you going to pantomime?
Am I gonna pantomime? I'm gonna show you what's on the screen through my eyes. Oh, hey, you're here. What's that? I thought I did it right. Oh no.
These millennials, they know how to do it all. Oh, caps lock is on.
We all have your presentation in our packets too.
Great, thank you. I think I changed one of the slides, but for the most part, it's the same.
Okay, sorry, Mac people. Where the heck do I find the driver?
Under Finder.
Oh, that's cool.
Oh, you're ordering. There you go.
Brian.
Colleen, do you want to just Colleen, do you just want to start?
What's that? You want me to just start?
Yes.
Okay. Sure. So I'll just say, next page.
There you go.
If that works for you, and then sorry for everybody else in the audience. So, Kamala, my name, well, that's hello and good afternoon. My name is Colleen Dushkin, and I am, I have the pleasure of being the administrator for the Association of Alaska Housing Authorities. Oh, there we go. I guess this is for everybody else's benefit since all of you can't see it, so. Okay. So I'd like to say thank you to the council for inviting me here to speak today, especially Susie and David, who took a keen interest in the association and what we do. So the AHA memberships includes the 14 regional housing authorities and the Alaska Housing Finance Corporation, and we meet. We meet quarterly. I don't know why it's. Okay, hold on. We meet quarterly, and we have an annual meeting every year. It's a time when all the 14 regional housing authorities come together. We're really the AHA is the link of bringing all of the tribal housing authorities together. So just a little bit about the regional housing authorities. They were developed or established in 1971, and their borders they're bordered around the Alaska Native Claims Settlement Act lines. And of the 237 Nahasda tribal recipients in the state, the AHA members represent 196 of them. And so the core funding for the regional housing authorities is through the Indian Housing Block Grant, which is the authorized through Nahasda, or the Native American Housing and Self-Determination Act. I think I got that all right. So AHA members are in every corner of the state, and they build affordable housing in some of our most remote areas, in addition to the urban centers in Anchorage and Fairbanks. So they help reduce overcrowding, they preserve existing housing through programs like the weatherization program, and they house families and seniors. And additionally, the regional housing authorities are one of the largest employers in rural Alaska, and they play a critical role in sustaining the local economies. So what does AHA do? So we have two primary activities, but we provide unified state and federal advocacy, affordable housing development, and funding information and training and technical assistance, all in an effort to increase the supply of safe, sanitary, and affordable housing. And I'll go into more detail about these two activities as we go on. So we have a training and technical assistance program, and this is delivered through the HUD Office of Native American, or well, it's not through ONAP anymore, but it's a HUD grant, and it's got a number of activities, and it's really to build capacity in tribal housing. So some of the two core TA activities we have is the regional trainings and the direct technical assistance. And this is where TA contractors go on site to tribal housing authorities, whether it be the 41 additional tribal housings or the 14 regional housing authorities in the state. And they're really to develop capacity. And one of the things that we're very proud of is for our regional housing, our regional trainings, the programs are developed directly for Alaska. So they are our material is vetted through our local ONAP office, and it's really geared towards our tribes and TDHE, our regional housing authorities. One thing that I'd like to highlight is we've been doing a few master plans in the past, and one of which was the Newtok-Matarvik relocation. So we did through the TNTA program, we did the
the affordable master housing plan for that, and it included the number of homes, the type of homes that the community would need in the new site. It documented the infrastructure needs and the funding types that would need to go along with that project. So that was something that we were very proud about. The other key kind of activity that we do is advocacy. So we have a robust advocacy process where we have an active legislative committee that meets both as on as needed basis to address a number of issues. Every year we develop priorities that are based on the challenges that the regional housing authorities are facing. It's a consensus basis committee, and then those anything that comes out of that committee is then taken to the board and ratified by the board. It's important to understand the time and dedication that the regional housing authorities put into helping develop these documents. They truly are the experts in the areas, and they do spend countless hours to help ensure that those documents are correct. We also have do things like if there's legislative bills that are going through Congress, making sure that we provide testimony to try to get them passed, advocating for additional funding. Thank you to the governor who supported and wrote letters for to ensure that the Indian Housing Block Grant was funded for the state under NAHASDA. So this is a if you go to, I'm going to just touch on these programs. These are the 4 priorities that were listed in our last state priorities. We're going to be developing our new priorities coming up next month. And so these are the documents. I don't have them printed out for you, but they are available on our website. But I do want to touch a little bit on each of the programs. So the Supplemental Housing Development Grant Program, it's a program through AHFC, and a big thanks to AHFC for being a good partner in developing and leveraging funding for the regional housing authority. So the Supplemental Housing Development Grant Program has been around for over 25 years, and it's really a key tool for the regional housing authorities to be able to leverage federal funding and non-federal funding to develop and rehabilitate homes across the state. So they, with that funding, there are standards that come with, so the regional housing authorities are building to the B standard, which is the energy efficiency code. So they're really extremely energy efficient, affordable housing. Another I'd like to highlight is the weatherization program. Since 2008, 20,000 homes have been weatherized in 185 communities. That is not only with regional housing authorities, but regional housing authorities really play a key role in developing that and administering that program throughout the state. And of course, with the funding environment, those funding sources have been down. But we're advocating for making sure that the Supplemental Housing Development Grant Program is funded, weatherization is funded. We were supporting the MEBA, which is a loan program for community and regional housing authorities to apply to have energy efficiency upgrades to buildings in the communities. And again, all of the information is on our website to grab. And we could, maybe Carrie, I can get a copy of those documents to you and you can forward. On the federal level, our top priority has always been NAHASDA reauthorization. NAHASDA is the primary vehicle for Indian housing funding to come into the state and to be distributed across Indian country. It hasn't been reauthorized since 2008, so it's just a very top priority for the Regional Housing Authority members. Without having an authorized program, it makes investors leery to really build upon the leveraging tools that the Regional Housing Authorities need. NAHASDA has been flat funded since its inception. And so it's really lost that huge purchasing power. I know that the plenary speaker, Deborah, is that her name? Oh, Diane. Diane spoke about how that funding has eroded. We've done different calculations, and HUD also has a different calculation, but it's been essentially flat funded since 1998. So, and then the last priority was a tribal enrollment question. Tim Olson, who's the director that covers census for our region, announced at AFN that they would not be requesting tribal enrollment on the 2020 census, which is great. Some of our other initiatives, homelessness, the regional housing authorities are able to provide homes to some of our communities to lessen, the overcrowding situations. But I think the bottom line is there's not enough funding. Health and housing, I've heard it as a theme throughout this conference, which it makes me really excited because it's an initiative that we really want to take on. Really, that health and housing are connected, and to have housing is to be a healthy community. So I have to again thank Diane that brought those comments forward. I heard it in the coalition updates. The gentleman from Savunga, talking about that mold, healthy housing, healthy communities, it really is interrelated. So how do we really tell that story and make sure that everybody is making that connection? And finally, I think this is a slide that's changed in your book or in your handout, and I think I should have named this partnerships. We need your help. What can you do to how can we work together? How can we form partnerships to make sure that we are advocating for safe, affordable, decent housing? And so some of these are, we're always told to, what are your stories? What are your housing stories? And we're not talking about the bad housing stories, or the good housing stories, really documenting the success stories and the continued needs in the communities, and how we can, if we can rely on you can rely on us to do things like submit testimony, have public testimony when there's NAHASA reauthorization coming up, or when there's funding bills passing. So really, how can we, it's to start a conversation on how can we work together to advance our mutual issues. And finally, how can AHA help you? How can we really create these partnerships to make the connections? Because we're talking about housing, which is a direct correlation to corrections and to health and to all of, I think it's so widespread that really, how are we going to come together and make sure that we can fund and have affordable housing to benefit everybody? And with that, Kagasakun, thank you.
Thank you, Colleen. I have a question for you. So in the spirit of the conversation that we've had today about capacity, and you operate a very robust technical assistance program, if and given that the regional housing authorities and tribal governments are super important out in the rural areas as well as many of the other communities, is it possible for an organization, let's say, use an example in Bethel, wants to undertake a permanent supportive housing project, could they, working through the tribal council or the regional housing authority, come to you for technical assistance to kind of address the capacity issue that people have been talking about in terms of who will help them kind of puzzle through putting together the development and mirroring the services through either the state system or through the Indian Health Service organizations that are out throughout the state?
That is a very good question. I would answer that by saying, and one thing that I guess I didn't explain was kind of that process, the training and technical assistance process, where if the tribe came forward, and the tribes need to request services directly to HUD ONAP. And so if the tribes came forward and they were able to demonstrate how it builds capacity within their Indian housing program, I would probably say that would be an eligible activity. And I mean, as long as it's within the Indian housing, they have to be Indian Housing Block Grant recipients. And so how that looks, I don't know if it could directly go for the development of supportive housing, but how it can integrate to build the capacity of the tribe itself. So whether that be helping them to be able to do program development or something that builds their capacity for them to then do that. So I don't know if that answers your question or not.
I think so, because
Okay.
here in Fairbanks, Tanana Chiefs Conference operates a supportive housing, a Housing First project, and then it's always kind of thinking about that and how perhaps, similar projects like that could be developed across the state.
Yeah, well, the good thing is that the answers lay with HUD.
Okay. All right, we'll get Deb Alston to say and Colleen to say yes later on after the show. Any other questions?
Not really a question. I'd just like to make a comment that I'm really excited to see the regional housing authorities much more engaged with the homeless coalitions, since that really seemed to be a key piece that had been missing for many years. We're not traditional homeless providers. We aren't usually running shelters. We aren't doing a lot of the things that some of the homeless coalitions are doing, but we're building housing stock in the rural areas, and when there is no housing stock, that's the only way to address a homeless problem. So I'm really excited to see the regional housing authorities. I'd like to thank, Colleen, Susie, Dave, HFC, get everybody in the same room and make sure we're coordinating better and just keep moving forward.
Thanks.
And I wanted to confirm, you've been flat funded since 1998.
Yes.
Okay.
The Indian Housing Block Grant has been.
Thank you.
Is that
Any
it?
other questions?
Thank you.
Great, thank you so much. So the next item on our agenda is a discussion of the Alaska Supportive Housing Plan with Carrie Collins and Susan Masante.
Mr. Chairman?
Yes.
I unfortunately need to leave here about 4:20 to catch a plane. So I'd really like, hopefully, that the presentation was relatively brief so that we could talk about and maybe actually take action before I had to leave.
Absolutely, and given that both these individuals have certain reasons to listen to both you and myself, I think that they've taken that into consideration.
Sure, cut me off. Okay, so I'm not gonna speak for very long because you already have a written report which speaks to the housing plan that DHSS responded in terms of our progress on that. But what the message I think I want to give you as the council is that even though there have been several asks for this council to adopt this plan and endorse it, it doesn't mean it's been sitting on a shelf getting dusty. There's been lots going on. There's lots of progress already on this. So I'm just going to go real quickly and say, so for example, one good example is the moving home program vouchers. 150 vouchers are out there throughout the state. The problem, of course, is that we've used them all. We had 100% utilization with a 90% retention. So people are staying housed with a combination of vouchers, rental assistance, and services. The 811 program that we've been speaking to most times we come here is actually ready to start a 10-person pilot any second. I said that last time, but really, it really is happening. I know that I've heard today talk about workforce and workforce development and not necessarily having the people on the boots to the ground to help with the services. So a couple of efforts in that regard. One effort is that the division is spearheading a move to certify and train people themselves who are in recovery to be available to people who are not far enough along on the not as far along as they are on that path. Not specific to housing, but a lot of places are using people in recovery as some of their on-the-ground support services. So that's pretty exciting for us. I think the really, really big thing, and I just want to highlight this, is that Alaska was awarded an innovation accelerator program grant from CMS. And the point of this is to get the housing folks in the room with the services people who provide the services and fund the services to really put together a full package of services that will help people get housed and off the streets in integrated settings. And this is an exciting opportunity. The team is made up of our housing partners, which is AHFC, the Association for Alaska Housing Authorities, who you just heard from, the Alaska Housing Coalition on Housing and Homelessness, and 3 divisions from the Department of Health and Social Services. So we've got the Medicaid folks in the room, we've got the Division of Behavioral Health, and we have Senior and Disabilities Services in the room. The Trust has got at least one person working on this amazing team. We're keeping Elizabeth Schultz in the governor's office informed, and we're looking to decide who else we might need in the room. But one of the things, as I was hearing people talk today, is that it seems like there's another ask is to really look at this idea of a funders collaborative, and you know, we think that doesn't necessarily mean just a housing provision collaborative. It also means services and housing. So maybe we can begin to answer that question through the IAP. At least we'll have some conversations with some experts in the room. And I'm going to stop so that Carrie can go and you guys can move on your resolution.
Thanks, Susan. And Randall, I will keep it very quick. So just like Susan highlighted a couple of the things that are happening, I want to reiterate that just because the plan hasn't been adopted doesn't mean that work hasn't been being done. And we recognize that this has probably brought to light an opportunity to continue to better streamline our communication about the work that is being done throughout the state. So, but I specifically want to speak to housing development goals that were in the original plan, provide some progress on that. If you're following along, it's goal number 3. So progress to date on that plan since 2015, there have been 226 new units developed for homeless and disabled Alaskans in 11 communities throughout the state. In addition, there have been 32 project-based vouchers through AHFC's Public Housing Division that were awarded to the new Housing First PSH project in Juneau. There's a couple other sort of assumptions or recommendations that were in the plan about housing development that we want to speak to, as we've done some progress on those also. So one of them is the review of the Special Needs Housing Grant Program. In there was a recommendation for housing development by backing out some of that SNUG, Special Needs Housing Grant Program funding, with Medicaid billable or Medicaid billing, and also with Section 8 housing vouchers. And Susan, being very quick and running through her update, didn't have a chance to speak to it, but in our discussions with DHSS, and Susan, Randall, please correct me if I'm misstating this, it seems that the services that are the assistance that's being supported through the Special Needs Housing Grant are not Medicaid billable services. So backing out that piece for Medicaid support is not a feasible option. And then also the other piece was bringing in those Section 8 housing choice vouchers in order to bring out or back out the operating support for the that is currently under the SNUG program. There are 15 projects that are supported through the SNUG program. Only 2 of those would be eligible for Section 8 vouchers if they were made available. So that kind of puts into perspective that there's not as much reliance on that assumption that's in the plan in order to lead to housing development. So I wanted to speak to that really quickly. And in addition, in your recommendations that we'll move to next for that we're putting forward is the link between the continuum of care housing support for 60 to 100 units over the next 5 years. And so after looking through where all the housing supports are coming from, most of those continuum of care units that are being supported or could be supported in the future are also supported through other funding sources, such as the Special Needs Housing Grant Program, the Greater Opportunities for Affordable Living, or AHFC's matching funds to COC programs. So the goals in the amended packet have been adjusted to reflect that duplication. That was quick.
Thank you, Carrie. So I believe at this time we need a motion to adopt the resolution.
I will make a motion to adopt Resolution 2017-1.
Seconded. Any discussion from the council? Hearing none, I will take a quick roll call. And that would be Steve Williams.
Here, yes.
Let's see, Randall Burns.
Yes.
Diane Casto, are you still on the line?
Yes, I am.
And are you voting?
Yes.
Oh, go ahead.
Yes.
Okay, thank you. Betty Svensson.
Hi, yes, I am here.
Okay. Was that an affirmative vote for the resolution?
Yes.
Olin Harris.
Yes.
Susie Pearson.
Yes.
David Kuiper.
Yes.
And Mark Romick. Yes. Motion carries, and we have adopted Resolution 2017-1, the amended goals and action steps for the Alaska Supportive Housing Plan. Thank you, everybody. Thank you, Carrie and Suzanne. Moving on, the next item on the agenda is the Alaska Plan to End Long-Term Homelessness. Susie Pearson, Dave Kuiper giving us an update.
Dave, please interject. Whatever, yeah.
I think he's offering the gavel to you.
Yeah, of course. We normally have a tug of war over this one. But this is, I'm going to be brief because most people have the packet or have the packet online. So this is the Alaska's Plan to End Long-Term Homelessness. It's the 2017 Progress Report, which is the second year that it's been in effect. And once again, this report is based on a feed-up model, so all of the information is coming from our local communities as far as their activities and what they're doing that can feed into the priorities of the plan. The Alaska Supportive Housing Plan that we just adopted was a companion piece to this plan and primarily impacts priorities 1 and 2. So I'm going to point out a couple examples that are, I thought were very creative, and I mean, they're all super fantastic, and so, but I want to really point out a couple here. So priority 1 was about housing development, and the supportive housing plan has done a great deal. They've been very active in that area. I also wanted to recognize the Nome's local tribe, the Nome Eskimo community, using some of their funding to develop new rental assistance for their tribal members. As Colleen talked about, and as we've discussed amongst several different conversations, that we need to bring in tribal funding so that rural programs can help get support that they need in order to address the housing problems that they've been experiencing. So I really think that that's a very exciting step that we're making. And another one is the Kenai Peninsula, the detox beds that they've had created. To Catherine and her community, this is a really fantastic opportunity for all of us to start to look at different models. This is an area that has impacted housing and homelessness considerably throughout our state, and especially with the increased opioid problem. Having resources is incredibly critical to breaking the cycle of homelessness, not just having housing, but having access to resources such as mental health and substance abuse. And we know that even in Anchorage, that there's not enough services, and that throughout the state, there's definitely no services in many communities, and they're having to go to other larger communities, and then oftentimes, as somebody said, they're getting stuck in a hub community like Bethel and not moving back into the village. And so you're ending up with folks that are once again then caught into a cycle of homelessness. Priority two around supportive services. This is a key issue. We've had so many grants in the past 10 years moving over to capital and not getting the supportive services that we need in regards to case management and the assistance that those who are homeless and at risk of homelessness desperately need. That case management, what it's doing is ensuring that that person has the support that they need and the access to resources and the guidance that is critical to successfully ending substance abuse in their life and achieving housing on a stable and permanent basis. Priority 3, I think we've heard a lot about that today in regards to education, engagement, and policy. It was so exciting to hear Diane Yentl talk about the National Low Income Housing Coalition. I've always gotten a lot of feedback and response from them for support as an agency, and their information is spot on. It helps me just work with my legislators to help them better understand what's going on in my community. They're an excellent resource, and we're talking about policy data. This is what we want. This is the story that we want to use in order to make things happen. Dave's story starts with data, but then it also is the story of each individual and what they're experiencing. And really, this is some critical support that we've got here. And priority 4 is prevention support. And prevention this is something, as somebody who works in a shelter, has had a difficult time getting folks into safe, supportive housing. This prevention effort, or even to stop people who's in a domestic violence situation, and maybe they've been able to get the abuser out of the home, but they don't know how to maintain their housing. This kind of prevention work that we've been doing through BHAP and other programs, very critical and life-sustaining for many, many. It's in our communities. And I'm trying to make this fast for you, Mark. And then, of course, we come back to data. And I think that Brian, he's talked about the fact that he's a data geek. I think you actually find a lot of people in this room are data geeks. And most importantly, the people you want to talk to, like your legislators, the people that have money, are data geeks. They want the numbers. And HMIS, all of that has been really critical to ensuring that we are successful in obtaining those numbers. I think that ICA, which is the Institute for Community Alliances, they've been our contractor for our HMIS, or Homeless Management Information System. Their support has been incredible for both Anchorage and for Balance of State. They've created reports. They've made sure that we've done collecting data, that we've had training, and I would have to say that's one of our best partnerships ever related to data. And I want to make sure that everybody, if you don't know them, you should know them. These are incredibly smart people. And finally, as far as I know, it's not part of the report, but I did want to say that we get to do this once a year as far as discussion and reporting on our plan, but we only get to do this at the coalition's conference. And I think that each year this conference has been going on for almost 2 decades. I don't know if folks know, some of the earlier conferences were in the Brother Francis shelter. So the fact that it's been going on has been great. And the last 10 years, the work that Scott Schaumburg and Brian have done have been incredible. They've really pushed a lot of just the engagement and the energy and the involvement that they've had through the Balanced Estate has been I think I really want to honor that and make sure that they know that and that we all recognize the work that they have done. And to finally, as far as the other thing that I wanted to say is for us to be a part of this at the conference is really critical. We have our meetings twice a year, and the fact that the coalition actually creates time on their agenda for us to be here to talk to and listen to you has been, it's critical, and it's the way that we get information, and it's the way that we find out what's happening, not just through the reporting, but through the actual stories, and the conversations one-on-one are really important. So thanks for that. And that's all.
Thank you. Questions from council members?
Dave?
Okay, the next item on our agenda is state agency updates, and we received a lot of information from the different agencies about what's going on in their departments related to programs and services that address homelessness. And so at this point, I think we just have kind of an open section to ask any of the agencies if they'd like to add anything to their presentation, or council members if you have any question of any of the material that you read in the packet. And I'll start with Diane and Betty on the phone if you have any questions or things that you'd like to add.
No, I think it was all pretty clear. And I will say this is my first time attending, and I'm attending for Allison Hanzala, our special assistant. I've participated in some of the homelessness and housing issues over the last number of years. But I really am pleased and excited to hear such a broad array of folks talking about this issue. It's so critical to everything that we're dealing with right now in the state. You know, you think about right now, I'm in Juneau, and we just started the new special session, and HB 54 and crime and domestic violence, sexual assault. All of these things are so tied into everything we're doing. And I just was so pleased to hear so many people talking about the need for case management, the need for mental health services, substance abuse services, services, safe housing for victims. So I don't have any specific questions, but I'm just really pleased, and I think we've made tremendous strides in the last few years in this issue. So thank you.
Thank you. Olin, Dave, Steve? Okay. Well, thank you, everybody. I guess that we come to the end of our agenda, and I just wanted to take a moment and reiterate what Susie said about thanking Brian and Scott and everybody that was involved in putting the coalition meeting together this year, and how important it is for us as a council to be here and listen to what everybody has to say. I also want to remind everybody that even though we only meet twice a year, we do have an email available in case anybody would like to provide comments to us at any given time during the year, and that is iach@ahfc.us. And so we're open to hearing on any subject over the course of the year, even particularly outside of the meetings that we have. I want to thank Carrie from our staff and Daniel and Kathy for organizing our portion of it and making things happen. And with that, if there's any other last-minute comments from the council members? Hearing none, I will call this meeting to an adjournment. Thank you.